Hello everyone. Today we are going to learn another important CNS pharmacology topic, drugs used in the treatment of Alzheimer's disease. So first we must understand what Alzheimer's disease is, why it occurs, what changes happen inside the brain. If you understand the disease mechanism clearly, the drugs become very easily. Next, introduction to Alzheimer's disease. Alzheimer's disease is a progressive neurodegenerative disorder. It mainly affecting memory, thinking, learning, behavior. It is the most common causes of dementia in elderly people. So, what is dementia? Dementia means progressive decline in brain functions severe enough to affect daily life. Patients slowly forgot names, places, family members, and daily activities. So imagine an elderly person keeps forgetting where they placed things, repeats the same question again and again, cannot recognize familiar people. This may indicate Alzheimer's disease. What happens in the brain in Alzheimer's disease? Certain neurons inside the brain gradually degenerate. So two important pathological features occur. First one is beta amyloid plaques. Abnormal protein deposits accumulate outside neurons. These are called beta amyloid plaques. These plaques damage neurons. Next, neurofibrillary tangles. Inside neurons, abnormal proteins accumulate. These twisted fibers are called neurofibrillary tangles. They interfere with normal neuronal functions. Next, important neurotransmitter change. One very important neurotransmitter decrease in Alzheimer's disease, that is acetylcholine. Acetylcholine is very important for memory, learning, concentration. When acetylcholine decreases, memory functions becomes impaired. So most anti-Alzheimer's drugs try to increases acetylcholine levels. Next, symptoms of Alzheimer's disease. So early symptoms are forgetfulness, difficulty remembering recent events, misplacing objects. So moderate symptoms are confusions, difficulty speaking, mood changes, difficulty recognizing people. The severe symptoms are loss of communications, loss of mobility, and complete dependence on caregivers. Next, the treatment goal. The current drugs do not completely cure Alzheimer's disease. Treatment aims to improve memory temporarily, slow symptoms progression, improve quality of life. Next, classification of anti-Alzheimer's drugs. There are mainly two groups. First one is cholinesterase inhibitors and the second one is NMDA receptor antagonist. Cholinesterase inhibitors, they are further divided into reversible inhibitors. Reversible inhibitors are donepezil, rivastigmine, galantamine. Irreversible inhibitors, tacrine, dual binding inhibitors, cuparation A. Second one is NMDA receptor antagonist. The drug is memantine. And other drugs are antioxidant, herbal or natural product, and lifestyle and pharmacological approaches. Cholinesterase inhibitors are most commonly used drugs. These are in this cholinesterase inhibitor, the acetylcholine gets breakdown by an enzyme called acetylcholinesterase. These drugs inhibit this enzyme. So acetylcholine breakdown increases, acetylcholine levels increases. This is improves memory, attention and cognitive functions. So more acetylcholine means better neuronal communication. This is the basic principles of cholinesterase inhibitors. And the next one is donepezil. The donepezil is one of the most commonly prescribed anti-Alzheimer's drugs. So uses are mild Alzheimer's disease, moderate Alzheimer's disease, and severe Alzheimer's disease. The advantages are once daily dosing, better patient compliance, and the side effects are nausea, vomiting, diarrhea, insomnia, and bradycardia. Next one is rivastigmine. So rivastigmine inhibits acetylcholinesterase and butyrylcholinesterase. So this is available as oral capsule and transdermal patch. The patch reduces gastrointestinal side effects. The side effects are nausea, vomiting, and weight loss. Next, galantamine. Galantamine are similar to donepezil, also enhances nicotinic receptors activity. The side effects are GI disturbance, dizziness, and loss of appetite. Next, memantine. Memantine drugs works differently. So, what is glutamate? Glutamate is an excitatory neurotransmitter. Excess glutamate activity may damage neurons. This process is called excitotoxicity. So mechanism of memantine is memantine blocks NMDA receptor. So excessive glutamate action decreases the result is neuronal damage reduces. The mainly used in moderate Alzheimer's disease, severe Alzheimer's disease, and other combined with donepezil. The side effect are dizziness, confusion, headache, and hallucination. Next, difference between Parkinson's disease and Alzheimer's disease. The students commonly confuse these diseases. Parkinson's disease main neurotransmitter decreased. Dopamine, the main problem is movement disorder. In Alzheimer's disease, the main neurotransmitter is decreased. Acetylcholine, memory disorder. This is very important viva question for all. Next, so the non-pharmacological managements are family support, cognitive exercise, safe environment, nutrition care. So caregiver education is very important for Alzheimer's disease. And so the cholinesterase inhibitors increase acetylcholine, memantine blocks NMDA receptors. This is very commonly asked in exam. So study clearly. Okay. Next, the Alzheimer's disease is a progressive neurodegenerative disorder mainly affecting memory and cognition. Most drugs work by increasing acetylcholine or reducing glutamate mediated neuronal damage. Although these drugs do not completely cure the disease, they help improve quality of life and slow the symptoms of progression. Thank you.